Hi, everyone. It's Michelle Gramolia. I'm the CEO here at Woodland Pond at New Paltz. Today is Friday, February 26th, 2021. And this is my noontime broadcast on Fridays. So I'm going to take you, through a few things today. I just would like to mention that we have decided and we've got the technology in order to be able to actually re-air these broadcasts at 8 p.m. on the same days that I do them. So they will air live at noontime on Tuesdays and Fridays for the foreseeable future. And then we will, of course, record them and make them available on our YouTube channel, which I typically also send out in an email link with an update. And we will air them again at 8 p.m. on Tuesdays and Fridays on channel 1340. So for those that miss it at noon or would like to rewatch for any reason, if we have a topic of particular interest on a given day, you will now be able to see these at 8 p.m. On the same days that they air originally. So Tuesdays and Fridays. So let's get into it. We are another several days now into our planning for reopening activities starting on Monday in independent living. We have had a great week of visits in our health center. We've welcomed many people. And as of today, our capacity for skilled nursing visits has doubled from where it was even yesterday under the governor's new expanded executive orders. So we're really hoping that if you are a health center loved one or a resident, that if you're a resident, that you're encouraging your loved ones to come visit you. And if you are a loved one, that you are making as many visits as you possibly can, because we've got lots of visiting slots available. And we don't want to see any of those sitting, with no visitors. We want to see as many of you visiting as we possibly can. This is a great opportunity for us. So as we look at next week for independent living, March 1st, we do have a wide variety of items that are going to be coming back onto your calendars and amenities that will be reopening. I will show you, we've got our full-sized calendar, front and back, all ready for March. Gretchen Dahm has done a yeoman's job in getting everything kind of slotted back together after about a one-year hiatus. I really have to give a huge amount of accolades and kudos to Gretchen. Everyone on campus has just been so remarkable throughout this entire pandemic. Gretchen is one of those that stands out in terms of how flexible she's had to be and how resilient in terms of all of the starts and the stops, and especially last year in March and April and May, as we were trying to get our feet under us with using 1340 so much more and finding content and live streaming. And Jason Irish has been absolutely instrumental and flexible in allowing us to be able to broadcast live and film things and get things onto YouTube. And somehow Woodland Pond has developed quite the audiovisual team. We are, much more available digitally now than we were a year ago. All of you as residents and loved ones have become so much more comfortable with finding us, either on your computers or on your TV screens. And although there's been such an enormous amount of challenges in the last year, there has also been a huge amount of growth in so many ways. So thank you to, especially right now, Gretchen and Jason. And I have so many thanks to share, but I'm feeling especially grateful right now that we are going to be able to start March 1st with a very full activity and amenity calendar and offerings in independent living. I will be issuing a memo to follow, and you will see today, you will receive your Chanticleer, which is the week's news. Just normal announcements and those kinds of things. Tomorrow, I will be issuing the independent living activities and amenities, what to expect on March 1st. But in a nutshell, as we've talked about over the last couple of weeks, it is planned at this point to reopen just about every amenity and activity here on campus in independent living starting on Monday. And, we've actually put things into 3 categories of risk. So each of those risk categories will be described in my memo and then outlined in terms of when those types of activities will come online. So generally speaking, on March 1st, we are planning on reopening, for example, the complimentary coffee station in the pub. And all of the details, of course, will be in my memo and on the calendar, and the hours of operation document that will be in your newsletter on Monday. We will be reopening, the bank will be reopening next week. Fitness classes will resume in person, all of the committee meetings that would like to meet, the residence council meetings, the interest groups, all of those things will resume in person if the facilitators have asked for such. We are bringing back all of the card games and a whole bunch of other things for March 1st, because that's considered the first level of, the least risk, the first things that we feel we can start right away on March 1st. On March 15th is the second round of things that we'll be resuming, and you'll see those are slightly more risky or things that we deem to be higher risk. And I'll explain in my memo, why we've determined that. It really has to do with, the proximity of folks and, some of the safety parameters aren't quite as tight for those activities. So we need to just have a second round. So essentially, the first round of activities are the safest, quote unquote, given our current situation with just about everyone in independent living having been vaccinated. So we're going to start those things on March 1st. They'll run for 2 weeks, assuming we have no outbreaks, no illness, et cetera. The next level of the higher risk activities will start on March 15th. You'll see all these things in my memo. And then there are just a couple of things that will actually resume on April 1st, which are really the highest risk activities. And you'll also see that in my memo. So lots is going to be going on as we go into March 1st. Just in terms, again, of visits and visitation, March 1st, residents will be able to and welcome to meet with each other in your apartments, in your cottages. No appointments necessary. No, you don't need to sign up with anyone. Of course, and this will again be in the documents that you get from us in the next couple of days. We are going to, of course, ask you to keep your masks on and keep 6 feet distance during your visits. And if you do, again, choose to have a beverage or a food item, pull your mask down, take a bite, pull the mask back up, keep 6 feet distance, those kinds of things. That's going to be also starting on March 1st. It's our anticipation, as long as we can get the rapid tests that we need in independent living, which we believe that we will be able to. We believe that we will be able to start welcoming visitors from the outside of the community into independent living in your apartments and cottages starting March 15th. That's not a definite, and I did mention this in a couple of documents, and I will do so in my memo for tomorrow. It's all contingent on getting rapid tests. So we are very, very close, and I think that we're going to be there. So I feel optimistic that that is definitely in the higher risk category, just because most of the visitors have not been vaccinated that would be coming from the outside, and just about all of them are continuing to do some sort of normal life out in the public. So it's not the same bubble that we're living in here at Woodland Pond, and certainly not the 99% ish vaccination rate that we have in independent living. So definitely not the lowest risk category, but we're getting comfortable with welcoming back visitors from the outside, with reservations and those kinds of things on March 15th, as long as we can get the rapid tests. A couple of the things that we're looking at in the very highest risk categories, just due to volume of people and the type of activity for April 1st, would be the resuming of happy hour, the club, and the birthday party. So those are really the highest risk, just because those tend to be much more fluid. People are very close quarters, and there tends to be a higher number of people involved. So 3 levels of risk, 3 levels of reintroducing of things. So, but we're really excited because we really did not think we were going to be here until probably June. But our partnerships with the Family Health Institute and Independent Living, and then with CVS and the federal government and the health center, are allowing us to take all of these steps forward. So we're really excited. Definitely please pay attention to the notes that are in the Chanticleer today. We've got a number of important things that are covered, including an update as to where we are and information that you need to know about the piano fundraiser. The benefit fund actually was able to, they can only distribute a very small amount each year based on the way that the fund document is written, but they were able to release or will be able to release a donation for the piano fundraiser. With that, it'll bring us to about half of what we need. So we're getting there. But please check out your Chanticleer for some more information on that. We would really hate to miss this opportunity. The more that we've been talking to people about the fact that we may have the opportunity to have a 100+ year old Steinway, which is in remarkable condition, ivory keys and just built by hand, and every component is just, I'm hoping that we don't miss that. So if you have a propensity for such things and you'd like to make a donation, however small or large, we're about halfway there, and we could definitely use the help. So check out the Chanticleer to see if there's anything else that you'd like. I must recognize, of course, that today's menu has 3 chicken items on it, a clam sauce with pasta and salmon. So we know that, that's going to be challenging for some of you. Again, we're still in that same first week when we were not anticipating being back to the full room service menu. So Ronnie's team has still been working to cobble together, meshing what was going to be in the bistro in the afternoons or the evenings to what's on the room service menu. So next week, it's Ronnie's intention to have, not multiple things of the same types of items on the menu. So please just bear with us with that. And again, if you have not visited the bistro lunchtime between 12:30 and 2 p.m., there's so many delicious options, nice hot things. For those that are craving beef, there's nice burgers there. You've got Reubens and some other options and beautiful salads. So please don't just, tie yourselves to that room service menu. Today, especially looking out my window, it was warm when I came in. The sun is shining. It's really beautiful out. So I hope everybody gets outside today that can and get some time. I did have one question that came to me via email overnight, and I'd like to do my best to address some of that. A lot of you have asked questions about, visits, and I've just mentioned where we are in terms of visiting on campus. So March 1st, we are going to welcome all of you to visit with each other, Woodland Pond resident to Woodland Pond resident in independent living, to visit with each other in your homes and, certainly in your alcoves and common areas of the community with safe distancing and with masks on. So that's going to be March 1st. And then March 15th, as long as we can get access to rapid tests for independent living, we're looking at starting visits with outside folks on a scheduled basis. We'll offer those most days of the week, not all days, because we do have to staff the rapid testing. But we will offer, visits to you with your loved ones from off campus as long as we can get those rapid tests, March 15th. For you going off campus, the rules set in place by New York State for folks that are in assisted living, garden view, and skilled nursing are very prescriptive. So if you are a resident of any of those parts of the community and you'd like to go off campus for a visit with a loved one, please reach out to someone on that unit, whether it be the charge nurse, the case manager, or the social worker. They can provide you guidance as to what the return protocols will be. Because that's very prescribed by New York State, and I don't want to misguide you in any way. Some of those things are changing by the day, so depending on when your actual visit is planned for off campus, the rules could be different. So please speak to someone directly on your unit if you live in skilled nursing, assisted living, or garden view, and you plan to go off campus. In independent living, these are the things that you would need to keep in mind if you'd like to go off campus and have a visit with someone in their home, for example. So you've been vaccinated, most likely. There are only 5 or 6 people in independent living that have not been vaccinated. So in my conversation, I will assume that you've been vaccinated. I will assume most likely that the people that you're going to visit are not vaccinated. And so essentially, there are a few things to keep in mind. You have been able to go off campus. I mean, we don't police the campus. Everyone is free to go as they please. It's just that when you return, there are certain protocols that have to happen. So in the event that you went off campus and stayed with someone, let's say for a few hours for meals, or you went for a visit overnight or a couple of nights, or you went away on a vacation or whatever the case may be, you need to just let us know, and we will let you know what the protocols will be when you come back. The reality of the vaccines, whether we all like it or not, is that there is still no science definitively, although it's starting to come together. There's no science that says that having the vaccine prevents you from transmitting the virus. So we have to look at this like, yes, you've been vaccinated, which means that if you do contract COVID, which you still can with the vaccine, that you will not have a very serious illness. That's the whole intent of this. So it's very possible that you can contract COVID while you have the vaccine. All of us can. It's just that it will keep you from getting so sick, hopefully keep you out of the hospital, and certainly hopefully keep you from, passing away if you were to have serious complications. So the risk of transmission is still very much there. So when you're thinking about, the risks of yourself going off campus to visit with someone, you need to keep that in mind. What I would like or ask of you to do is, if you are going to go off campus to visit with someone, that you contact either Mary Jo Murray, our wellness RN, Sarah Hall, who is our Director of Resident Services, or myself, and we can provide you some guidance depending on the specifics of your situation. This is no different than where we've been in the past. We probably will institute a quarantine when you get back, and also some protocol related to testing. As far as how long the quarantine, what it entails, and what the testing protocol will be, will depend on the circumstances of what you do. So, for example, if you travel on a plane somewhere and you go to a state, well, really anywhere, if you go on a plane, or if you go on a train, or if you go on mass transit, that's going to dictate one set of protocols. And if you go to, have a meal with somebody at a restaurant, in town, each of those things will dictate something a little bit different. But I do just need you all to keep in mind that the most important thing to remember is that because you're vaccinated does not mean that you or anyone else cannot transmit this virus. So in that we have, or will be reopening the campus, we each have to continue to look at ourselves as a potential transmitter. So although I am vaccinated, I live in a household with others. My husband works out in the public. My kids are in school a couple days a week. That virus can still come to me, and I can still transmit that virus to you. I may never have a symptom of that virus, but I could have it and I could test positive. So I am going to continue to act as if I am a transmitter. So I'm still going to limit the number of meetings that I have. I'm always going to wear my mask. I'm always going to keep 6 feet distance, because I don't want to transmit the virus. As we get more and more people vaccinated, the viral load will go down for everyone and the transmission likelihood will reduce. But we're not there yet. So yes, many of us are vaccinated, and yes, we are all then less likely to become really sick if we contract COVID, but we can still spread it and we can still contract it. So that's sort of what's underlying a lot of the decisions that are being made. The risk is lower, which is why we're very excited to be able to institute a lot more of our activities on campus. But when we're talking about engaging with people from the real public, including our family members and loved ones, that's where we have to really be as extra careful, because folks are working, folks are going to the grocery store, folks are starting with sports and activities, and it's all great, but that means the virus can still bounce around. So just check with us and we'll provide you that guidance. We want you to go out and do these things. We want you to go visit your family members. I think it would be fantastic if you decided, what, I'm going to go see my family for 3 days. And then if that means that you have to come back and quarantine for a week, I would think that for most of you, that would be really worth it, because the last time that you've probably seen your families has been quite a long time. So just give it some thought and let us know what your plans are, and we'll help you kind of work through that. And if you have any questions at all, you need anything from us, just let us know. But the final message that I have is just keep an eye out this weekend for several documents that are going to come your way, explaining what to expect on Monday, and then in the next couple of weeks as we go forward. I hope you have a great day, and I'll see you all soon.